The topic today is around safer at home, stronger in mind. So, occupational therapy strategies for fall prevention. We have two wonderful guests in the room today. We have Morgan Berry, who is from E3 Therapy Solutions. And then we have our own Margaret Ward, who, if you have not met her yet, you will soon. But she is our new family care navigator. We are really excited about today's topic. This is a continuation, really, of our last topic last month, which was really, really loved by so many people. We got a lot of really good feedback. So with no other ado, we'll pass it over to you guys, and you guys can get started.
Okay. Hi, everyone. I am, as Cody said, I'm Margaret Ward. I am the new family care navigator at the clinic, Memory Movement Clinic. But by training, I'm actually an occupational therapist. I keep my license active, and I just was actually a treating OT as recent, I think, as October of last year. And I found out about the memory movement. One of my patients was a patient here. And I looked into it and I thought this looks like a great place. So I am the family care navigator. My main role here is to provide caregiver support, either educating them about support groups or co-facilitating support groups, being on top of all the resources in the Charlotte area, which can elder care lawyers, you name it, we pretty much have a resource for you. So my information is also on the website. And I'm happy to be here and thank you all for coming. And I'll hand it over to Morgan.
So I'm Morgan Berry. I am an OT with E3 Therapy. So we work a lot with memory and movement. We have a therapy gym here in the office. Me with OT, I mostly do all of my treatment in home, which is great. We get to come to you guys and perform the treatments in your own home environment, which helps it carry over for all of our training. So,
yep. And today we just really would like to talk about, I'll be asking Morgan a lot of questions. We'll kind of have some OT dialogue back and forth, but we want to first talk about prevalence of falls. Not too much on the statistics, but a little bit. And then, who's mainly at risk for falls and where do falls happen. So I'm going to kind of leave that back over to Morgan if she can kind of give the intro on just falls in general.
Yeah, absolutely. So as we age, falls do become more prevalent, unfortunately, especially once we get to the age of 85 and over. And women are typically impacted more than men. Yes. In terms of in the home, the bathrooms and the kitchen are by far the greatest areas of fall risk. So we really hone in on looking through all aspects of safety in those areas specifically to make sure that we can prevent falls and keep you as independent and safe within your own home environment as we can.
Morgan, what about who would you say would be more at risk for falls and maybe some triggers that might lead to a potential fall?
Yeah, absolutely. So some things that are that can be changes are weakness, cognitive changes, visual changes are a big one. Hearing changes can also impact fall risk. And then within the home, any kind of uneven ground. So the entry points can be a very big area. Rugs or even the change between the flooring, whether it be hardwood to carpeting, can be a change. Footwear is a really big thing that we look at with fall prevention. If you're going to wear socks, make sure they have a tread on the bottom, or the slippers, same way. When you wear shoes, you really want to have shoes that are nice fit to your foot, not the open back shoes. They're very hard to keep on.
No flip-flops.
Yes, unfortunately.
No Crocs. I don't even like Crocs.
Yeah. Unless you have them in the, with the heel off the back. Some other issues can be lighting. Lighting is a big factor when we go, and we'll talk some more about some options for lighting, where you might be able to find it, how you should set that up, and how to make it the most useful in your environment. So.
And I don't know if you said medications.
Oh yeah, polypharmacy.
Yeah, polypharmacy medications. If you happen to get on a new medication, and you just don't feel right, or you feel like your balance is off, just, or you have vertigo, whatever side effects you might have, just make sure you contact your primary care physician or whoever's overseeing your medications, and let them know.
Absolutely.
And when I was a treating OT, I would always tell folks too, when you get up in the morning, after you've been laying down for sleeping for 8 to 10 hours, just always get at the edge of your bed and make sure your feet are flat on the floor, and just stay grounded and take some deep breathing in through your nose, out through your mouth, and making sure you don't feel off balance, dizzy, and then you can slowly get up. Because some people get out of bed and they get up so quick that sometimes when that balance, is off, and that can lead to a fall. So just be careful when you're going up from supine to sit to stand, and then just getting up quick too if you're just sitting down.
Absolutely, especially if you have a blood pressure impact, that drastic change can cause a fall. So we want to make sure that you're aware. And even once you stand, give yourself some time to feel acclimated to being in the standing position, and then feel free to walk forward once you feel safe and secure.
Good. Leading back to kitchen and bathrooms as the most prevalent place for a fall. One of the things that Morgan does with E3, she does home safety evaluation. So I'm going to have her talk a little bit about that. Well, actually a lot about that.
Yes.
The different things that she looks for in home safety evaluations, the rooms that she focuses on, the education she provides the patients and the families, reimbursement as far as insurance.
Yeah, absolutely. So we can start with insurance first. Insurance does cover for me to come out and do an occupational therapy evaluation and a full home safety evaluation. So through Medicare normally covers all of it, and then the in-network plans, it's just like a typical copay, but it will cover for me to come out and do or another occupational therapist, of course, do the full evaluation. Now, when I come out to do the evaluation, I do look at all the home, but we spend most of our time in the bedroom, bathroom, and the kitchen, just because that's generally where we are the most. So we'll kind of walk through the home, and I'll just give some tips on what we kind of look at when we're in there. So starting with the bathroom, the biggest thing would be starting with getting on and off the commode. If there's any challenges with either sequencing the steps, sometimes we tend to get leaning forward too far, and that can cause a forward fall. Or using the toilet paper holder, that can become a very big issue. People knocking that off the wall or thinking it's stable. A towel rod, those are not meant to be grab bars, even though they look like a grab bar. So one thing I would recommend is, if you are going to install one of those, go ahead and make it a grab bar. That way we're safe if a patient does decide to use those in the event of a loss of balance. There's a lot of different equipment that we can use for a grab bar or a toilet paper holder that can turn grab bar, so that they're fastened appropriately and to be able to be used. In the shower, you want to make sure that you do have grab bars in there. If it's a tub shower that we go through in therapy, practicing the transfer, there's different equipment like a transfer bench, so that you won't have to actually step over the tub if that is an issue for you. There's a couple of different kinds where the chair can slide itself, or you can slide across the chair. But we want to make sure that you're safe and staying as independent as possible, to keep you doing all of your toileting needs in your own home environment. And then another thing that's not really thought about a lot is the even just grabbing things out of the cabinetry. So if it's low, you want to bring those to a higher level. Either put something in the cabinet to bring it up, put things actually on the counter, or in a top drawer. Those are the best ways to avoid rolling or reaching down. For getting up and going to the bathroom at night, lighting is super big. Yes, using night lights or motion detector lights. They have some that you can even put as strips now. You can have them as plug-ins, so as soon as it senses your feet, it'll light your whole entire pathway without bothering a partner or whomever is sharing the room with you.
I have a lot.
Yeah,
I have them all over the house. My husband's
they're
like,
very
"Whoa."
helpful. Yeah.
But I have the kind where it detects, and then after like 20 seconds, it goes back to dark. So it's nice.
It's like an airport runway.
Yeah,
Yes.
honestly.
Yeah.
But I love my night lights.
And they're super important.
Yeah, they're very important.
Yeah. And then in the kitchen, similar kind of things. We don't want to be doing our heavy pots way down low. For bending down rugs in the kitchen, a lot of people like those. Um, Rugs are not a great thing. I know a lot of people still like them. If you're going to have a rug, a thin rug and very secure. It's the only one that's going to pass the fall prevention test. And I'm sure you've experienced the same thing with going into people's homes.
I would say back to the shower. One thing I always recommend as an OT, if you're sitting down on a shower chair, it's really easy to install a handheld sprayer. You know, the sprayer that just you just take the shower head off, get one of those. You can get them anywhere, a handheld sprayer. So then you can, spray your body off while you're sitting down. Those are always really helpful.
And they can they have attachments like to the grab bar or even the shower chair. So you can just hook the water right next to you. You don't have to be doing the up and down, putting the water back away.
And it's good if you have a dog and need to wash your dog.
There you go. And then other furniture. So making sure your walkways are really, really clear. And then if you have any sort of blood pressure issue, I would say is a big one. If you have a long hallway or a long trek from your bedroom to the kitchen, make sure you have seating kind of throughout there in an open area so that if you start to feel symptomatic, you have the ability to go ahead and sit down and not have to try to get to a safe place to sit. So that's super helpful.
I'd say that too for in the kitchen, if you have like COPD or some kind of diagnosis that you get really short of breath, but you love to cook, it's always nice to have a place that you can sit at the counter. I'm not a real fan of like tall stools, but sometimes they have the stools with the back on them. So if you're able to sit and you're gonna, chop vegetables or something, you just want to sit at a counter height. I used to recommend that a lot. And then also if you just conserve energy, just sitting down when you get dressed or sitting down in the bathroom if you have to sit when you shave, or just having a really sturdy chair close by in your kitchen, your closet, your bathroom, as just another means to sit if you need to, if you just have low endurance or any kind of shortness of breath. That's always really helpful.
Yes, I agree. And sitting down to get dressed is a huge fall prevention technique.
Let's see, kitchen, bathroom, did we cover them? Bedroom.
Bedroom at the edge of the bed. You want to make sure everything is clear for when you do get up in the morning. Some people have an extra rug next to their bed. I would try to avoid that. If you have a high bed, I would try to discourage using a step stool. I know that can be quite common actually to have a step stool to get into a very high bed. To go along with the dressing, if you do have a high bed, putting a chair in the bedroom or getting dressed sitting on the commode is always recommended so that you're not bending down too far to run the risk of sliding off the bed.
And preferably if you are going to put a chair, make sure it has nice, strong, sturdy arms.
Yes.
A chair that has arms, that really will help.
Yes.
And you can even kind of push it against a wall. So if you're standing and you happen to lose your balance, the chair is not going to go anywhere because you already put it against a wall. So I always recommend that too. In line with like energy conservation, I always recommend for my folks who have real severe arthritis too. And like when you're pulling things from a cabinet, just you can get those, I don't say plastic, but that nice like is it melamine? What's that material that's like plates are made out of? It's like that outdoor plasticware, but not like plastic, not like paper plates, but it's a heavier plastic. So when you're getting things in and out of your cabinet, it's just lighter weight and they clean easy. You can put them in the dishwasher because some folks who just have, weak hands, it could be, or anything, arthritis due to whatever diagnosis you may have, it's just easier to have lighter weight plates, and keeping everything, like Morgan said, just keep it at the counter level or just the bottom shelf of your cabinet. Just keep things easy access, really. So you're not bending, you're not reaching high, because all those can lead to losing your balance and falling. And same with the refrigerator. Try to keep everything eye level so you're not putting things like a gallon of milk. Keep it as, or just get a half a gallon. Keep it as where it's easy to pull in and out of the fridge.
Absolutely. And there's all kinds of different recommendations we can have, but it is going to be person specific. So if you do feel that there is going to be a need for us to look at some home safety, it's okay.
Yeah, I guess. Keeps zooming back into the market. I'm not sure why.
Speaking through you.
Yeah.
If you do feel that there is a need for home safety, that is something that we can always go over. I know I had one client who had so many kitchen gadgets and she loved to cook. And so putting all of it on one level was just not going to work out because there were so many. So what we actually worked through was finding a kitchen system that worked very well for her, to where she could pull out the drawers. Every single cabinet had multiple drawers where she could pull them all the way out. So she didn't have to put her heavy pots and pans down and then in the back of her cabinet, which helped keep her as very independent in the kitchen. And she wasn't having to do a whole lot of squatting, getting on the floor, couldn't get back up kind of situation. So that was a great.
So Morgan, when you finish with your home safety checklist, and let's say someone needs a ramp or grab bars installed, E3 does not do that. The OT and the therapists don't do that. So who do you normally recommend for those installations?
So if the family does not have their own, some family members would like to install it on their own, in which case, or if they live in like a independent living, typically they have to have their security or the maintenance people that are on campus do it for them. So I will just put markers right on the wall. I'll have the patient sit on the toilet or a chair or wherever, simulate where they would put their hand, and I will mark it directly where it is, the size of the grab bar with painter's tape, and just make that so that when the maintenance crew come in, they know right where to go, or the family member. Now, we also do refer to, I use Green Light Mobility a lot. So they are a husband and wife duo that are PT, OT. Well, she's an OT and he's a PT, and they started this company where they come into your home and do a lot of renovations. So I've done everything with them from, installing a ramp to just a couple of grab bars to totally revamping kind of like the shower setup, whether it be take off glass so that we could get in a transfer bench, things like that. So they're a really great resource to use. There's also Carolina's home medical equipment. So for like beds, wheelchairs, oxygen equipment, they also have that. And I think one thing we mentioned too, we're in talking about insurance, is you can also get the Medicare will pay for some things. I think we saw the rollator or a walker and a wheelchair. The only thing is those are every 5 years. So we do need to make sure that they're appropriate at the time. But if you do get other equipment, you can get tax reimbursement off of those, off of any medical equipment that you do have to purchase. So that's nice.
Morgan, talk a little bit about, we talked about cognition earlier before we started the webinar. Talk a little bit about cognition, falls in cognition, how that affects safety awareness, and how those all are interchanged.
Yeah, absolutely. So I actually saw a great little quote that was basically saying that cognition and fall risk are kind of a two-way street. So cognition can increase risk for falls, just as a fall can increase risk of a cognitive decline. So with cognition, we do find a change in safety awareness. So whether that be impulsivity, so fast movement, we're just moving more faster than our feet are wanting to move. That can cause a fall when we trip over objects, or I find a lot that people try to reach for an object that's in their vicinity to try to catch their balance, and that may not be a stable object, and there goes the object, and then there you go. Same with walker safety, making sure we're locking the walkers as a secure piece of equipment to keep us stable. Some of those things we just have to use visual cues to help with the cognition, so that remembering where the brakes are, or a cue to lock the brakes. Sometimes we just need a nice colorful note in our view so that we remember these things. And as far as the falls with cognition, those can just, anytime we have a fall, it can exacerbate any kind of symptom that we may be experiencing. So
Yeah.
cognition just being one of the main ones.
Then I think too, when someone has a fall, then they kind of develop the fear of falling,
Yes.
which is a whole nother, area that a therapist work on. Because when you have a fear of falling, you tend to tense up and your whole body is just tense. And then it just makes it just mobility a little bit more difficult. And they just have so much anxiety about falling again. So therapists work on that a lot when they go into the home and address that.
I agree. Fear of falling actually increases fall risk exponentially. So one of the assessments that we do during an evaluation is the fall efficacy scale. So there's an array of questions that ask you, if you have a phone call or somebody at the door, how confident are you in being able to get to that in a time efficient frame? And where's your level of confidence there on a scale of 0 to 10? And then let's address that. Let's figure out what we need to change in your environment and figure out how we can make you feel safer.
And sometimes if the patient's able to, you actually simulate a fall. I mean, you actually have them get down on the fall and you say, okay, Mr. Smith, you fell down. How would you get up? And you basically teach them, how to safely get back up. So then it makes them feel a little more confident. Okay, if I did happen to fall, I know what I would do. I think everyone gets a little bit of panic mode. But if you just teach, and
absolutely,
it can really benefit people and take some of that anxiety, away from the fear of falling.
Yeah, and doing fall recovery training all in itself. So same thing, even if we worked on getting up and down off the floor off of a nice secure piece of equipment, and then we crawled to the open area and figure out how you would get back. There is research to show that it does reduce the severity of a fall or the injury due to a fall. Also increasing your level of independence and confidence of getting back up, or reducing the fear of like, hey, you know what, if I were to be on the floor, I can get myself back up.
Right.
And I can keep myself from getting injured. So it does reduce a level of fear while we're in the standing position, which will decrease risk of falls.
One thing we forgot to mention of fall prevention, we all love our little pets, but sometimes little dogs, well, really any size dog for that matter, can be a fall risk. So if you have and cats, if you have little dogs, big dogs, just be aware of where they are in the house, so you don't happen to stumble over one.
Absolutely,
it can happen no matter what age you are. Tripping over a dog or a
absolutely.
cat. Yeah.
Absolutely. And there are a couple of different techniques we can do. As an occupational therapist, we go through all of your roles and routines, right? So if your role is to take care of your pet, getting down on the floor to change your litter box or change out food or water can be a fall risk. But there are different equipment that we can do to help you to pick it up, bring it up to you without you having to actually bend down. Same with doing household chores. A lot of things that we just don't necessarily think of. So sweeping, using a broom and dustpan, right? That's not our safest thing to bend down and sweep into the dustpan, but we could get a tall handled dustpan where you can stay standing up and sweep in so that you're still feeling like, active in your home management, but safe at the same time. So, yeah.
Oh, good.
Have we had any questions pop in so far?
We have not, but we had one comment from someone who said they've used green light mobility and they said they're excellent.
Oh,
perfect.
good.
Yeah.
Yeah, I've also heard a lot of really good things. His name is Felipe. Yeah, Felipe. Yeah, I've heard really, really great things about installing grab bars. They make the process a lot easier for them. They kind of give them a lot of range of options. So I've heard really positive reviews.
Yeah.
But at this time, if there are additional questions, you can come off of mute, or you're more than welcome to throw it into the chat um, to ask our two speakers any questions. So I'll give you guys a minute.
I have one.
Yes.
Bath mats and
Good question.
and tile floors.
Yes. So as much as we say no rugs, right? You do want to have something under your feet because we don't want to step out wet feet on tile floor. That calls for disaster. There are a couple of different things. There are stone mats that will dry your feet relatively instantly. Keeps all the water. It's a sturdy mat too, so it won't slide around. The other kind, there are some style rugs that have the entire bottom is like a sticky material.
Like a non-skid.
Yes,
Yeah.
and it's the entire bottom. I would not go for the real furry ones. As pretty as they look, they are disastrous. Yeah, so very, very thin profile is what we need. And then making sure every corner and edge is very secure. For coming out, we won't really encounter that, but for going in, we need to make sure that edge of the rug is secure before we step into the shower or the tub. So that was a great question.
And you can also do, if you have area rugs, which sometimes we all have area rugs, the larger ones, like an 8x10, you can get on the corners. There's like a rug adhesive that's not bad for your wood floors that you can put on the corners. Because you know when you walk and sometimes you just kind of stumble your foot a little bit over, and then that part of the rug always kind of folds over a little bit. Getting those adhesions on the corners keeps it more secure.
Yeah, there's a lot of different, and speaking of inside the tub, I think I heard you mention that you can do non-skid strips. The kind that I use a lot is they're completely clear. Once you put them down, you cannot see them. I even forgot where they put them down sometimes until you kind of feel to find out where they are. So those are really great, both for the non-skid aspect, but also for peace of mind. I've also put those on the built-in benches that are made out of tile. Those are slippery as all get out. So whoever decided those probably should have consulted an OT. But you can put those strips on there to also prevent the body from feeling like it's sliding. Or a towel works too. Once the towel's wet, it won't slide.
I'm curious, in your both of your experiences, do people typically fall, like each time I've had a fall, it's been this because of the same problem? Do people typically that you see, your clients typically, if they're prone more to fall forward or trip on something, or do people randomly fall in different ways? I don't know if that makes sense.
I would say that it's a lot of time the same thing. And unfortunately, once we have one fall, your risk for falls increases tremendously. And generally it is a lot of times in the same way. Now, whether it be in two different areas in the home, the cause of it is likely a very similar situation, whether tripping over something, having freezing of gait, just lack of seeing what was in front of us, or an obstacle that we may have just not noticed.
Or maybe not wanting to use their walker or cane and say, oh, I'm just going to go in the kitchen for a minute, and they don't bring their device. That could lead to a fall. You know, or like we said, like getting up too quick, you know, you're sitting down, you get up quick to get something, or you want to get the remote and you're reaching over and you just, you know, fall forward. Yeah, there's a variety of
there's a variety of ways. But generally speaking, once one person falls, they generally fall in a very similar manner, from at least of all the falls that I've seen, similar. So posture is a big one when it comes to fall prevention as well. So if you do find that is something that's impacting your fall risk, it's important to consult. And the good thing about when you're in the therapy team, we refer to each other. So if I feel that there is a cognitive component that is that the speech therapist I know would be really great in helping me with that, I would refer them to speech. Similar with if I feel it's a gait pattern, whether they're scissoring or just having an excessive like just gait pattern that is causing them to fall or trip, then I would refer them to PT because they're the real specialists in figuring out how to fix the gait.
Hmm.
So there's a lot of different ways that we all work together as a team, along with family and the patient themselves, to really kind of tag team.
Mhm.
That's a good question.
Yeah.
Do you have any recommendations on like washer, dryer? Because there it can be low.
Yes.
We have a stacking one, so it's hard to
Okay.
raise it. So, I mean,
Okay.
I just wanted to see what your,
Yeah, absolutely. So I would use a short-handled reacher
okay.
for any of the stackable. So they're both front loading, I would presume.
Yes.
So a short-handled reacher will it keeps the weight of the clothes close to you without you having to bend down quite so far. I've found that to be a tremendous difference for any of my clients doing laundry, both the low front loading as well as the top loading washing machines for my short little ladies trying to get all those clothes out. The short-handed reacher really helps with those.
Mhm. And sometimes those front loaders, you can get risers on them too, where you put risers underneath them and it makes them a little bit higher.
Yeah.
Which is helpful.
Yeah.
Somebody had made a comment saying raising the cat box is always a great idea.
Yes, raising the cat box and the food and the water. Definitely can, spill it as you're going down. Then we got water all in our area, so definitely want to keep that area clean.
One of the things I thought about is stairs. So how can you prevent any falls or strategies to help with stairs?
Perfect. Great question. So when it comes to stairs, you want to make sure you have railings, preferably on both sides. If there is vision impairment, we can add some things to help really illuminate, whether it be strips on there, changing the coloring between. Sometimes if the flooring is the exact same throughout, it's very hard to see the depth perception, especially on dark flooring. On steps, it's very hard to see. So just putting like a brighter color edge on the base of each step can help you kind of identify where the next step is. That can also be first steps to enter the home as well. And then there's also stair lifts. So if we needed to go that route, there's always stair lifts that we could do. Now, if that is that is just an option. We still want to keep you as independent, mobile as desired. So it's just patient specific. Just depends on where everybody is.
How about gardening outside? I mean, that seems to be a big trip factor, trying to move over plants or rocks or.
I would agree. So doing outside work can be a fall risk, but we can also just use elongated tools. So trying not to get down to the ground. If we really like to garden, you can get raised garden beds, which are really helpful. They just go in like a giant box, if you will. But then you can do it for flowers, or you can do vegetation as well inside of those things. Brings it up to hip height. But getting if you have to do things on the ground, just get a long handled hoe or a shovel and try to do it from a standing position as best as possible. But taking your time is also a big factor. Don't ever feel rushed to do something of that nature.
Sometimes they do have some gardening stools too that you could sit on, like it's a little outdoor chair.
We looked up one yesterday that it has an adjustable seat and it's on rollers.
But it also has handles on the side so you could push yourself up.
Yeah.
Now, the only thing I would say about rollers is to make sure you can lock them.
Yeah.
Yes, locking mechanism is super important. I know they won't roll too well in the grass, but if you were on
It just loves you. It doesn't want to move over to Margaret. I don't know what it is.
If you do have it on like a hardwood ground, what you don't want is you to bend forward in a chair and keep shooting out from behind you. So unless you're hanging on with one hand, the risk of that is pretty great as well. So, but they do have chairs that will lock. So that's an important thing to look at. But a chair is a great idea.
Any chair with rollers. I used to work in an assisted living, and all the dining room chairs had rollers on them. And I thought, what a fall risk, because you just, if you if you lose your balance a little bit and you flop on that chair and it flings back and then you fall on the floor. I always wondered who the heck idea was that to put rollers on all the chairs. But I also tell folks too, if you're looking to buy a new chair, like a recliner, let's say you need a lift chair, one of the things I always say is test them out, because a lot of people are like, oh, I want a recliner because for whatever reason, or I want a lift chair, especially if you're a smaller frame, male or female, sometimes they're so deep. And you're like this, and people cannot get out of them. So you have to make sure there are some out there that are really not, they're shallow, I guess. They're just not deep, and they're more petite, and they're great, because I feel like patients can get in and out easily, because you've seen some of those recliners and that swallows you up, and then you just can't not get out. So I
agree. Or they're
avoid those, or yeah.
Yeah. So one thing that we can do too is take some measurements of the legs. So and then we can give you a recommendation like, hey, perhaps this is the style chair that you should be in the market for. And go from there. Chairs or couches.
Yeah. There's a lot on the market, really. I mean, if you go to Amazon, you can even get, if you don't have you have trouble getting out of a couch, sometimes they have like grab bars. There's like a mechanism that goes under your cushion that has 2 grab bars. So it's just like getting up so much easier. Because a lot of people can't push up from one armrest. Or, if you don't have any armrest, it's really difficult. So there's actually a lot on the market that can go under cushions, under your mattress.
On a bed too.
On your bed.
Yes.
Yeah. There's just a lot out there. Read the reviews though. I mean, sometimes you get what you pay for. So sometimes the cheaper ones are not, they're not as sturdy. So definitely do your research.
Yeah. And if you have an OT come out and do a home evaluation, then we can really hone in on every area that is giving you trouble, and we can determine ways of doing it in the most economical way as well, right? We don't want to just come in and say, okay, you need X, Y, and Z, and give you a whole list of things you can buy, when some things can be dual purposeful. Some things we can just teach you to do it in a different manner that may be safer, and you might not need an extra piece of equipment.
That was going to be my question, is what kind of strategies do you recommend for people when it comes to saving money around these? Because it can get really expensive really easy.
Yeah.
So what strategies do you have for that?
So going based on the smallest kind of thing that we need first, and then there are I would recommend checking places like the National Council on Aging, I think it was called. They have some things that they can offer, and sometimes it is just like they'll just hand it out. I've had some clients where they've gotten free walkers and free they had something in their kitchen that these people just came in and installed all on their own. They just saw it as a safety risk, and the Council on Aging just provided it. You can also look at like the local Habitat for Humanity. Sometimes they have stuff, or Goodwill. Now I'm sure you don't want secondhand stuff like bathroom equipment. That wouldn't necessarily be sanitary. But there are a couple of other agencies that are in the area that do take regular or donated equipment that you can find for cheap or cheaper. Like lifts are even, you can find stair lifts. I know, because once they install it in people's homes, these things become theirs, and the companies don't take it back. Now, if it's a metal, one of the metal ramps that like the VFW put in, they do take back. But is it VFW? Is that what I'm gonna say?
VFW.
The Army.
The Army.
Yeah, the military. VA. So if they take it, if they install it, then they will take it back. But the rest of the stuff, it just belongs to the family now, and they may not know what to do with it afterwards. So they find a place to donate it, and then reaching out to your therapists or people in your doctor's office, like what Margaret does, can find some resources where you guys could find some things at at a cheaper, more cost-effective rate, just because insurance does not cover these things, unfortunately. So
I think Southminster has a little nonprofit that they have donated
Okay.
materials as
Oh,
well.
that's good to know.
So it's something
Yeah.
I know they have. I can't remember what it's called, but almost like a pantry.
Okay.
Yeah, where
Okay.
you can kind of go and
That's good to
Yeah.
know.
What's it called again?
Southminster.
Okay.
I can't
it's right
remember
off
what,
of Quail or
Yeah.
Road near Quail.
but I can't remember what the actual nonprofit. I guess I could do a little quick search, but yeah. But I know there's a couple little places in Charlotte or around the area that have donation centers where people will donate like wheelchairs, rollators, like those things that can
Yes.
get really pricey. Um,
We
Yeah.
just got a sit to stand lift for one of our clients. And working with the social worker who's on her case of where, I don't remember the name of the place where she got it from, so I'll have to get back to you guys on that.
Yeah, that would be good.
but-
Maybe that's something we can add to our resource list
Mhm.
here at the
Mhm.
clinic.
Mhm.
Lending libraries, because sometimes people like have a hip replacement or knee replacement. They might have a walker, but they only needed it for 4 weeks. So it's
Right.
practically brand new,
Mhm.
you know, and that's usually where they Goodwill or Habitat.
Right.
But,
Yeah.
you know, be nice if there was a centralized location
Yes.
because to try different things out.
mhm.
That's good.
Do you have any experience with, I got this from my sister after she had a fall, but the suction cup grab bars that are, they're really heavy duty. I mean, I installed it,
Mhm.
but I didn't know if you've had any experience with them.
I have, and I've unfortunately experienced several that have come unhinged.
Mhm.
I know sometimes they're secure, and I could hang my entire body on one, and then the next day I could do the same thing and
Okay.
go flying.
Okay.
So I would always recommend installing one like a
Yeah.
screwed into the wall.
Okay.
I would never recommend the suction cups just because they're so unreliable.
Yeah.
Okay.
I agree.
Someday fantastic and can save you from a fall, and the next day
Mhm.
you're out of the tub. So
I agree.
unfortunately, I've even tried the suction cup ones that you just hold the handle, and sometimes those things are great, and sometimes they just flop right off. So
Yeah.
I don't. They're not consistent enough for me to
Yeah.
find them reliable. So
I'm glad you mentioned that because
Yeah.
it was a good one because therapists never recommend those.
yeah, so I don't
We say
think of it
no.
as a
Yeah.
as a thing to bring up.
good.
But I did want to go ahead and address your question too that you had this more earlier about doing dual tasking. So dual tasking does challenge our balance more when we do cognition and balance together. So those are always good things to practice. I would recommend consulting a therapist, PT, OT, or speech. We all do dual tasking in different ways. So I would consult them first before we just try to do stuff at home, just because it can increase risk for falls. But there are also some resources that you could use out in the local communities. So exercise groups are always good to join into. I know we have a couple of Parkinson specific ones around. So Rock City Boxing has a couple. The Pedal Posse, and that's a good one over at the Cornwell Center. Is that right? Back to Independence is she's also an occupational therapist, and she started a gym. Her name is Darcy, and she does a Parkinson's group on Mondays and Wednesdays at 12. So that's a good group there. And I think that was all for those ones. The senior center also does exercise classes. So if you're looking for something more, outside of the home, to get involved in, I think those would be a good one as well. And then you also mentioned you have your exercise equipment at home. When you're sitting and you're safe, go ahead and try to challenge yourself. Count backwards by 5s or 4s. Do the ABCs backwards if you're able to do so. Any kind of, try to name as many ice cream flavors as you can. If you have a picture of family or friends, try to sit there and name them. I use family members a lot.
I have a question.
Yes.
Is there anything you can use for safety in the shower when traveling?
safety in the shower with tremors.
when traveling?
When traveling.
Yeah, for
Ooh, that's
instance,
a
you
good
go to a
question.
hotel and they don't have, I'm with him. They,
She's not.
they don't have a bar in the shower, or they don't have anything to hold on to get up from the toilet. Um, and we tried that kind of thing you talked about a few minutes ago. That's not any good. The
Suction
suction things.
Yeah.
Is there anything on the market that you've seen that travels well and works well for those things?
So for the toilet, the best travel I've seen, and I'll have to get you the exact name, but it's a tri-fold. It folds up like a walker, but then it goes around the commode so that you can have arms to steady you from there.
Okay.
If you have a walker, really, you can just turn the walker around and back it over the commode, and then you automatically have armrests next to you on both sides. So that's a good one for the commode. As for the shower, that is a fantastic question. And the best thing I can come up with is if you're gonna take a smaller shower chair around with you. They do have some that are very small. However, they're not, I haven't found any that are foldable. So, I mean, you can take the legs off so it can become compact. You just have to reclasp the legs back in.
Thank you.
And I would
that's a
always
great question.
ask too, the hotel, there's usually accessible rooms, handicap accessible rooms. There's at least 5 or so, I would say, and see if you can get one of those rooms first too.
Mhm.
Well, and
Sometimes they
sometimes
come with chairs, but
that's kind of overkill. So, both of us have issues. So
Yeah.
it's just a matter of having something you can hold on to get up from the toilet, or having a safety bar in the shower.
Yeah.
And I have, when I've requested that, sometimes they'll put one in, but not too frequently. So, but those are good suggestions. So thank you.
yeah, awesome.
Yeah.
Thank you for your question.
I know we have about 10 minutes left, but one of the questions I want to ask is,
Mhm.
how can people find you? How can people get referred to you?
that's a
What ways can people do that?
So doctors here at Memory and Movement, they can refer to E3 therapy, and that's how you could get with occupational therapy. We also have physical therapy and speech therapy on our team. We all do come into the home, which I think is super beneficial. And any doctor can refer. We can you can always reach out, whether it's here or primary care, and get the referral order sent over to our office.
Does it have to be a referral, or can they call?
So we do have to get a referral. You guys can call, but then we would reach out to the doctor on your behalf. If we were going to do like a private pay where you weren't going to go through insurance, then we don't need the referral. But to go through insurance, we do need a doctor's referral. So yeah.
And another thing too, if you just want an OT home assessment, you can get that. So you can ask you still need a physician referral. But an OT, like Morgan said, she did one yesterday that she just came to the home and really did a home safety eval. So that's definitely something, especially if you want to age in place and stay at your home long term. It's definitely a good idea to get, as an expert looking at your environment to help you, age in place.
Absolutely. So we want to make it safe, but we want to make that environment work for you, and in the most economical and safe way.
Perfect. Any other questions from anybody online before we wrap this session up? Or in person?
Yeah.
Let's see.
I have a question to ask how y'all think about this. I've found that going downstairs can be really dangerous. So I go downstairs backwards, hanging on to the handrail, of course, but that way, should I fall, I'm not going to go to the bottom of the stairs, and the distance is less to fall if you back down. A doctor suggested that to me years ago, and it works. Do you all have an opinion?
Yeah, I've not, that's not a recommendation I would have, I've
Yeah,
heard
me-
of.
me neither.
Sideways is more of the one I hear, less on your knees. And then you can, if you only have one railing, that way you can have hands on both hands on the one railing to go down and go down sideways, rather than backwards, because you still run the risk of getting yourself all the way down. The other way would be, honestly, just to sit on your rear end and scoot your way down. Though that's not always the most ideal if you're one that experiences blood pressure issues and you find yourself stuck upstairs and maybe you're home alone one day. The safest way is go ahead and sit on your rear end and slowly walk yourself down that way. Especially if, you know, a phone is downstairs and you need to call for help in an emergency, or you have a fire and you've got to get yourself out of the home. That is the best, most efficient way for you to get down the stairs without running the risk of falling.
Thank you. That's helpful.
Absolutely.
Okay, well, I guess if there are no other questions, that wraps up our Take Charge Live. Thank you to our two speakers, Morgan and Margaret. But I hope everyone has a great evening. Thank you.
Thank you for coming.
Thank you so much.
Thank you.